Hello, everyone. Today we're going to talk about health appraisal and pre-activity screening. This is one of the first things you will do when you are working with a new client. You will have to conduct some interviewing and some tests to get to know your client a little bit better. So let's get right to it and find out what the process is. So the objectives for today is to understand what a medical and health appraisal process is. And it's something that if you're going to be working with individuals in exercise prescription, you will be doing, and also in other similar environments like in physical therapy and occupational, you'll be doing some kind of initial process before you decide whether you're capable to work with your client. And then we're going to determine if there's a need for our clients to go, before they become reactive, to go and get medical clearance from a healthcare professional. And also if they need that for exercise testing and training. So maybe you were a former high school athlete, or you are an athlete right now. One of the first things that you probably had to do before you could participate in school athletics was get a yearly physical, right? So imagine if we were to require any individual that wanted to join our fitness center or personal training program to go get a physical, regardless of their current health status or training status. That would mean, what do you think? That a lot of people would probably delay or not begin an exercise program because they don't want to go through the rigorous process of having to make an appointment with their doctor and have all those tests done. So the research supports the view that we don't have to send everyone out before beginning exercise. Some people may need to, but the vast majority of them can begin exercise, low to moderate exercise, which most beginners are going to start off with, without having to get that physical. Now, there are some exceptions to that, and that is the reason that we conduct this pre-activity screen. We want to determine which individuals do require a physical or medical clearance before becoming more physically active with us, either to the fitness assessment, which could be rather vigorous, or exercise programming. I'm going to break it down in all the steps and just think about the process and how it works. It's very similar to how you might seek another healthcare professional. If you're an exercise professional, the client may call you, or if you're working at a facility, they may be referred to you. And so how do you go through the steps of getting to know this client? So let's take a look. What are the components of the pre-exercise appraisal, right? And let's try to break it down as easy as possible. A lot of it is going to be a lot of information and paperwork, as you've probably experienced if you've gone to healthcare, through the healthcare system. Initially, that may require what we call the initial interview. Maybe this happens through a phone call. Maybe it happens through some Zoom meeting or some other kind of virtual meeting, or it may many times happen in person if they were referred to you. And this could lead, so the initial consultation, you can call it that, then it may lead to two possible decisions. Maybe some of the information that the client reveals lets you to believe that they actually need to be referred to a healthcare professional before you continue working with them. Or based on the initial communication, you decide the next step is to move to the pre-activity screening. Okay? And so that pre-activity screening, let's say that we don't send them out for medical, we don't send them out to another healthcare professional, we keep them in our program. The pre-activity screening then can lead to two different paths. So after we conduct, we're going to go through what a pre-activity screening entails. The pre-activity screening could lead into one or two scenarios. The individual may need medical clearance, right? Which means that we have to send them out to get that physical. That's the easiest way to remember medical clearance. They're going to need that physical. Other forms that we're going to have them sign, and there's links in your workbook of what those look like. Informed consent form, so lets them know that they are aware of what's going to be happening through either exercise fitness assessment or exercise programming, and that they assume the inherent risk associated with these types of activities. And all those are legal documents. And regardless of what you work, you're going to have some variation on these documents. And maybe you have a business on your own. If we, after the pre-activity screening, we decide that they're good to go, they do not need medical clearance, then you still though will have to get the informed consent and assumption of risk to be completed and documented and signed. And these are documents that we keep. If it's not a paper document, which most of us don't have paper documents anymore, it's digital, it should be encrypted and safe. So because it's confidential information only, we want to make sure that their privacy is guaranteed. So we're going to take care of that as well. So what does the initial interview look like? So again, put yourself on the role play a little and think about what this may look like. An individual calls you to find out about your services, or a client in a facility that you're working at is fair to you. So you're going to have to get to know this individual. Maybe you have some information already, you have a file on them or something like that. But you're still going to have to build some rapport with the client and get to know them on a more personal level. So in that initial interview, one of the first things we do is to determine if we sort of are compatible, if this person is going to be able to work with us, to work together. And that only happens if you have some communication. It may be that you connect and can work together. It's a very close relationship, but maybe your expertise do not match the needs of the client. Or there's other reasons that you might want to refer to somebody else after that interview. One of the things we want to do during the initial interview is to determine what brought them to us. What are their initial goals? And certainly we would work through these as we conduct more testing, more technical assessment, and we, as we may be familiar, we try to write goals that are more achievable, more, as we say, SMART goals, right? So we make, we negotiate these or talk about these and make sure they're goals that the client wants to pursue. And then another important document is the client-trainer agreement. All right, this is where you may discuss the cost of the program, whether what you're going to charge, if they if it's going to be weekly, they're going to be charged monthly. All of the specifics of that need to be covered in what we call a client-trainer contract or agreement. Are they going to be charged if they don't show up? How much are they going to be charged? What is your policy? If they need to cancel or reschedule? Every detail of everything that could come up is going to be laid out in this trainer agreement. And again, doctors' offices will have it, physical therapy, whatever programs you go, if you work with a client and they're going to be paying you for services, there's going to be some type of contract between the program and the client. I call it cover your butt. You're going to put everything in here. Right? So that's all part of that. Maybe you haven't talked about that in another class, but certainly keep that in mind. When you're working with a client, real people, this is going to be part of the process. Right? So now what are the components of the pre-exercise appraisal? Right? So what kinds of documents are we looking at? Again, it's a lot of, and many of these documents now, you may have them in some kind of digital format and not really paper. So sometimes people still do use paper, but probably going to be sometime in digital format. And again, we're going to keep these documents secure. One of the ones that you're probably familiar with that we can utilize is the pre-activity readiness questionnaire for everyone. That it was created by the Canadian Society for Exercise Physiologists, and we're up to the 2024 plus, and it can be used by the client themselves. For example, this is one that maybe once you have a phone consultation, that you can actually send to them in advance, and they can fill it out, and the form will guide them whether or not they should call their physician and have a physical before they even show up to your program. So we could do that, and we can also have a more involved medical history questionnaire that asks more questions that can give us more accurate information and will really guide our process of deciding on whether or not someone needs medical clearance. And if they don't, it will also guide us as far as what level of exercise intensity, low, moderate, or low, moderate, vigorous, that we can start at. So all this is part of the process that will guide us to determine whether or not we're ready to work with this client. Okay. So next is what the part of the pre-activity screening process. Again, the pre-activity readiness questionnaire. And if you go to PowerPoint, you'll be able to link to the Part Q documents. Again, it's the physical activity readiness questionnaire, and their Canadian Society of Exercise Physiologists just wants you, if you use it, to download it as is, to not like take the questions and put them in your own form. They actually want you to utilize their document as is. I know some people break that rule, but that's really what the copyright of it says. We can also conduct that health appraisal, health history form, and this major information that we'll have here would be emergency info. So who do we contact if something happens to you? We're going to ask about previous medical history, things that are relevant to exercise, and we're going to discuss what those may be. Any coronary risk factors, because we're going to use coronary risk factors to coach them into lifestyle changes to improve their overall health. Okay, so those are important for us to know, although we may not use those for recommendations for medical clearance. And then signs and symptoms. Oops, I skipped on, right? Or there we go. Let me put that. Oh, I'm going backwards. Sorry about that. So then, oh, I'm having such problems with my mouth. Okay, here you go. So then we're going to evaluate our results from the physical activity readiness questionnaire and our health history form. And we're looking for some major things. So I have this box here in yellow. All right. So this box here, if for anywhere in the interview with our client, or if anywhere on the health history form, any of these signs and symptoms come up. So the client reports that they lately have been having chest pains when they go up a flight of stairs. And it takes a while for it to resolve, right? Or they currently have it, or they have, you'll see shortness of breath, SOB is what we acronym for it, that is new and different with activities that didn't used to cause the shortness of breath. That's a big sign, especially if it's happening lately. Maybe they're bending down to tie their shoes, and that's causing shortness of breath, and it's lasting a while. Or just getting up to move around the house is causing significant shortness of breath. So anything new like that, that's going to be a major sign and symptom that we want to note. If they feel like they're going to faint, if they have irregularities in breathing at night, any ankle swelling, so anything here, irregular heart rhythm, tachycardia, intermittent claudication. I know that's a big word. It's just pain in the lower extremities caused by a blockage of an artery that exceeds the lower limbs. Usually the lower limbs. It can happen in other parts of the body, but it's usually the lower limbs, like the calf area. So if somebody increases physical activity, there's some type of blockage that the muscles of those in that region do not get enough blood flow, and when you don't have enough blood flow, that causes pain. Right? Lack of oxygen, ischemia will cause pain. So that's a sign of, could be a sign of peripheral artery disease. So we don't want to ignore that, and if we don't know what it is, it's one of those conditions that would elicit the need for medical clearance. So all of this in the yellow box is what we call signs and symptoms. If it comes up anywhere on your health history form, this is like a red flag, something that you would alert, something that you would mark. If you're able to highlight in your form, or if you're able to highlight on your digital document, you want to bring it out. And this is how we get it, where we get it from. Signs and symptoms of disease. We're also looking for someone that's been diagnosed with a cardiovascular disease. So maybe they had heart surgery or valve surgery, or they have a pacemaker, or they were born with congenital issues. That would be a cardiovascular disease. Or they have a metabolic disease. Metabolic is diabetes type 1 and type 2. Those are the ones we're looking for, or any kidney disease. Usually kidney disease may be related to heart disease, but we're also looking for anybody that has kidney disease for any other reason, anything related to the kidneys, because all of these three things are going to be affected by exercise intensity more than other things like pulmonary. which we used to have as a restriction, but now we don't. So pulmonary conditions are self-limiting. But if it's something related to the heart, if it's metabolic due to blood sugar, or if it's kidney, then we're gonna pay special attention, and we're gonna take special considerations and refer for medical clearance unless they have. We're going to talk about that. There's some exceptions to that. We're going to talk about the exceptions, right? So this is what we're looking for. This is the main red flags that we're looking for on the health history form. So now, what does the health history form look like? This is an example. There's many, and in your workbook, you have links to other health history forms. You may create your own if it's your own business, your own company. You may create your own. You want demographic information. You want to ask questions about cardiovascular, metabolic, or renal disease, because we're going to use those questions for making decisions. You may ask about medications, because sometimes they won't tell you that they have diabetes or they have something else because they don't think it's necessary. And if you ask for medications and you see that they're taking some metformin, a medication for diabetes, so they're on exogenous insulin, then you would know. Or if they're taking medications for heart disease, beta blockers, or diuretics, you will get an idea that they have a diagnosed condition. Okay, and you can further look that up, and also it would help you to know the medications, because then you can look at the effects on heart rate, whether they're going to get dehydrated more easily, overheated. There's many drugs that do that. So knowing the drug can also help you to plan for exercise. So that would be something you might ask on the form. You might ask about exercise history, right? And you might want to include that in your forms as well. But certainly the basic ones are the ones that will help us answer the questions to decide whether or not they need medical clearance. So what are the three main things we're looking for in the review answer after we conduct our initial interview in health history, pre-activity screening? Well, there are three important areas of consideration and that we're going to use to make this decision. We want to know their physical activity history. So again, hopefully you asked it on the health history. We want to know if they have a cardiovascular disease, a metabolic disease, diabetes type 1 or type 2, or a kidney disease, renal disease. And if they're currently experiencing any signs and symptoms, maybe they don't have a diagnosis, but they tell you that every time they go up a flight of stairs, at the end of that, they have severe chest and they got to sit down, and then it resolves itself. Well, something that we want to find out what it is. It may be related to cardiovascular disease. We'll talk more about that, but maybe it was stable or unstable angina. We want to know that and how severe it is, because at any point it could lead up to a full-blown heart attack. So important. And the reason for these, based on the latest evidence, is that in the past, known cardiovascular disease or metabolic disease was going to be an automatic red flag to refer. Now, if they're active, if they have been active for 3 times a week for 30 minutes for 3 months, they could move on to exercise, light to moderate. And we will only refer for medical clearance if we want to engage in for rigorous exercise. We want to do HIIT classes, for example, or we want to do higher intensity cardiovascular training, or high intensity, whatever, right? Sprints, so some other activity like that. So in the past, it was just automatic, and also we included pulmonary. Now, if they're active, we don't. So we don't have to immediately research. So we ask those questions. If someone though has a major sign, if you're experiencing a sign and symptom at the moment, it means a sign and symptom means they're something that you can measure. Blood pressure is high, they're irregular heart rhythms, their heart rate is up, things that you can measure, and they're describing to you some symptoms: chest pain, nausea, they're hot or cold, right? So there's other things that are, so it's happening right now, not something that maybe could happen in the future. They're experiencing right now. So because anytime somebody tells you something's happening right now, no exercise, we were, of the things in the box, major signs and symptoms, and that yellow box in that previous slide, we refer immediately to healthcare provider, healthcare specialist, okay? So important to remember that. Now, if someone has someone is symptom-free though, and they're a regular exerciser, and they can begin exercise at low to moderate intensity without having to go to the doctor first. So that's the major change that came about 2018, I want to say, with some revisions. All right. So how do we know that someone has a physical activity history? Well, no, and why do we use it? Well, the evidence shows, of course, we know this. I know this. It was just great that if you are having a chronic exercise, if you exercise regularly, especially after 3 months, you have a lower risk compared to someone who doesn't do any exercise of having any events happening during a physical activity. It is those individuals that never do anything, and then, well, we wouldn't know here, but I guess we could relate to a hurricane is coming, and now they're like installing boards to put on their windows, boarding up windows, putting up chairs, and they do all of this stuff when they've been sedentary, and then they go from low intensity to boom, and then a cardiac event could occur. Okay, those that have a gradually progressive overload in intensity and are used to, adapted to exercise, don't have as high of a risk. Okay, just think about how that is. If you don't never drink coffee and just have a little bit, right? Same with alcohol, right? But if you're used to it, it's going to take higher and higher dosages to elicit the same responses that it does for someone who's not adapted to it. So that's what we're looking at there. So how are we defining it? What is the baseline amount? We're saying that they need to have been doing it for at least 3 months time to develop that training status, 3 months, and they need to have to do it at least 3 days a week, at least 30 minutes, and at least at a moderate intensity. Moderate being 40 to 60 of heart rate reserve, which is the heart rate reserve, to remind you, is 220 minus your age. Then you take off the resting heart rate. As the heart rate, take off the resting heart rate, then multiply by the given intensity, and then plus your resting heart rate. So that's the heart rate reserve. That one's closest to your VO2 max, right? And that's more comparable if we would have tested your VO2 than the age predicted one, who doesn't take into account your resting heart rate. And so the intensities could be higher with that one. This one, it's 40 to 60 for moderate, less than 40 for low, and more than, it's really 40 to 59.9, but higher than 60 for vigorous, okay? Exercise, or a rating of perceived exertion of 12 to 13, which in a 20-year-old is about a 120 to 130, okay? So that's how we say, yes, this person is active. If they're meeting this low threshold, the lowest threshold here of exercise. They do more, wonderful, but they at least need to do this minimum. And then we can say yes to physical activity. Yes, they are physically active and not sedentary. So that's how we say yes. So what are known metabolic and cardiovascular, metabolic, and renal, as I said earlier? Anything related with the heart. Okay, they had heart surgery, they had a heart attack years ago. So if they have some heart valve disease, or they had a heart transplant of any type, counts. Maybe they were born with a congenital heart disease, counts. If they have type 1 or type 2 diabetes, or if they have some kind of renal disease, renal failure, of course, that would count as a CMR. And so we need to take that into account. We already looked at major signs and symptoms. Okay, so any of these are going to be asked. Do not pass go, do not collect $200, no questions. Doesn't matter if they're currently physically active. If a client comes in to see you and they say, oh, might have been having these chest pains, we're not going to have training that day. We're going to tell them to please call their doctor's office and speak to the nurse and let them know what's going on and see if they want to be seen. Usually people will be told, you can't overreact because it might make things worse. You say, hey, well, let's delay. If you actually suspect, though, that they're having a heart attack, just have them have a seat, go to another room, call 911, tell them you suspect somebody's having a heart attack, and then they'll be really happy once EMS arrives and checks. Okay, maybe they're overreacting, maybe it's indigestion, whatever. But if you suspect, you have a strong feeling somebody's having a heart attack, we do go ahead and call 911. Okay, but otherwise, if it's something they're saying is happening on and off, and so we're going to delay, if it's anything in this list, we're going to delay training, ask them to please call the healthcare provider, let them know what's going on and see if they need to be seen, checked up, and make sure that's clear before we move on with more exercise. So really important, there is no exception for that. Anytime there's a major sign as a symptom, we cannot move on with exercise. Medical clearance is going to be needed. Okay, so other components of the pre-exercise appraisal, and that is cool. The nice thing about it is we do work as part of a team most of the time. There's a reason you have your group projects. Many times we need dietitians. We need working with special population. We'll be working with speech pathologists. We may be working with a physical therapist. Sometimes a psychologist, depending on the individual, and so we need to work together. Maybe there's physician very regularly if it's a special population. So seeking the medical clearance allows us to continue this collaboration with other healthcare providers and determine what is the best treatment plan for our clients. Right, so it allows for that process, and then we know if there's any restrictions that we need to follow up on with our client. If a client is having chest pain, they should not be, again, if that's a major sign and symptom, the stuff in the yellow box, they should not be permitted to participate in physical activity unless we procure that medical clearance. Okay, and remember that we're going to go through it again, but really important. So what are the guidelines for medical clearance? Clients are physically active, all right, and do not have any major signs and symptoms. So they're not reporting anything. Excuse me, my cat is trying to go by. They're not reporting, this is Jacob. They're not reporting any known disease or signs and symptoms, right? Of disease are not required to seek medical clearance and may continue with moderate to vigorous intensity training and may increase intensity as tolerated. So clients are physically active, right? They do not have a CMR, do not have major signs and symptoms, can do low, moderate exercise, provided that they are trained to engage in those activities. For somebody new to exercise, we wouldn't start vigorous, we would gradually use progressive overload and move them up to that. But they don't need medical clearance. Those clients are sedentary, without disease or signs of disease, may start exercise training though with light to moderate intensity because they are new to exercise and they would not need medical clearance. But we wouldn't do vigorous, because we wouldn't do it just simply because they're new to exercise, right? So hopefully that's clear. The American College of Sports Medicine has designed this pre-activity screening algorithm. I find it the easiest to remember, but I'll show you a different way as well. It's used to identify anybody that's at risk for cardiovascular complications during exercise or immediately after, usually for aerobic exercise. So not so here at the bottom, for resistance training, not a lot of evidence, not a lot of studies have been done, but it seems prudent to assume that if someone's recommended intensity for aerobic exercise is light or moderate, let's stick to the same type of intensity with resistance exercise. Be conservative in that. So although we have a lot of information on resistance training and it's very popular, we don't have sufficient evidence to use this for resistance training. So my advice, my advice that we should follow is whatever the intensity ends up being for aerobic exercise, use the same for cardiovascular. And then it may be a question to, if you do send your client out for medical clearance, maybe a question to discuss with the physician if they do have cardiovascular disease. What is their recommendation for resistance exercise intensity, right? So you open up the communication between you and their physician or other healthcare provider. Okay. So what does the algorithm look like? So once we know there's a risk established, we can use this decision tree, and it looks different sometimes. This is just one version of it, okay? So if someone is physically active, right? Up here, they're physically active. We're going to say what they're physically active if they're exercising for 3 months, 3 times a week, at least 30 minutes at a moderate intensity, 40 to 60% of heart rate reserve. So the answer is yes, right? We can move here. So let's suppose we have a client that has diabetes, but they're physically active. So if they have diabetes and they're physically active, we go here. They do have a CMR, and let's say they don't have any signs and symptoms, nothing in that yellow box we saw earlier. So that means that they can move on to, they only need medical clearance for vigorous. Let's suppose we have another client who has diabetes, but they are not physically active. They're sedentary. So then the answer is no. They have a CMR, so they're going to need clearance for anything, for everything. No, that's it. But if they're active, then there's for light to moderate, they're okay to continue. Most individuals with a CMR will see the doctors more frequently than even once a year, especially if there are medications, and they see their doctors every 3 to 4 months to check the levels and to reassess if they need increase or decrease dosages. So it's not unusual. Okay. So again, we know that physical activity is most safe when the individual is active, does not have a CMR, it doesn't have any signs and symptoms, right? And it's least safe, increases the risk of cardiovascular event if they're sedentary and they have a cardiovascular metabolic renal disease and they're experiencing signs and symptoms. So that's from low to high risk, right? So we want to mitigate the risk as much as we can and only work with clients that we are clear to work with. So another helpful for some of students is this steps instead of the algorithm. Some people find this more helpful. This is from Guidelines of Exercise Testing and Prescription, the 10th edition. So I put it here for you. You can ask step 1. You can ask these questions. Again, how are we answering these questions? We can be asking our client, or we can be reviewing the health history form to determine this. So if you did mark any of the statements, then stop. Medical clearance. So major signs and symptoms, then stop. Okay. Then the next step is activity level. Okay, if they're active, at least again 30 minutes, 3 times a week for 3 months, yes. Then you can move on to step 3, and then we're gonna ask, have they had a heart attack, heart surgery, heart failure? So do they have a CMR? Then you evaluate steps 2 and 3. If they did not mark any of the statements in 3, they don't need medical clearance. If they did mark 1, then they continue to exercise light to moderate. Okay, so if they mark step no, then medical clearance is recommended. All right, and it may be that, so what may happen to some clients is that they may have to exercise at least for a while in a supervised medical facility where there's a physician present, nursing staff, exercise physiologists, usually clinical exercise physiologists, and they can be monitored. And if a heart attack happens, like you can in most in a hospital, instead of having to call EMS, you call a code, and immediately advanced cardiac life support begins. So some people may need to exercise in those types of environments. All right. So once again, here's your algorithm. Okay. So the first, I like the algorithm better than this because it starts with exercise setting the path of your life. Yes or no? If it's yes, it's a much better outcome. If it's no, then you have a lot more restrictions, right? So I like that side better. Now, hopefully you have any questions about medical clearance. So now we're moving away from medical clearance. What I'm going to talk about next is not related to whether or not somebody needs a physical, and it's confusing. One is called major signs and symptoms, and that is a straight go to medical clearance if it's a yes, if there's any, versus risk factors. Major signs and symptoms is the individual is having something happening to them right now. Risk means that it may happen in the future. They're not experiencing anything right now, at all, but they have certain modifiable or non-modifiable factors, risk factors that increase their chances of experiencing a major cardiovascular event in the future. Okay, so please understand the difference. It gets confusing. Risk factors versus major signs and symptoms. So here, why do we look at risk factors? Because we can use risk factors to make recommendations for lifestyle changes. And if we work on these lifestyle changes, we can reduce our clients' risk of ever having a cardiovascular event or cardiovascular disease, which is the #1 killer of Americans, both men and women. All right, so we're going to review this. So we're going to look at what are the risk factors are. If you have more than two, you have two or more, we're going to call that increased risk. And if you have one or less, it's considered low risk. So the goal is to have low risk, right? So that's better than increased risk. So, and only we assign one risk factor per risk area. One of them, HDL-C, is a good thing if it's high, so it cancels out any other positive risk factor. And realize in medical terminology, when we say positive risk factor, means that it's present. So if something in your blood is, you tested positive for this COVID, now we know that means you have it, right? So it's not good or bad, it's present or not present. Okay, in medical terminology. So let's take a look at review the risk factors. These are from your workbook. Risk factors for CVD include age, and we can't change that. You know, even if you change, maybe if you improve your biological age or how your body is aging, the times that you've been around the sun, that's not changing. Okay? It is what it is. So we see here that for men, the risk, it will be a positive risk if it's 45 or older, and for women if they're 55 or older. So if that's present, you're going to put a plus for age, meaning positive. Family history. And by the way, in your workbook, all of these are links to other for further explanation. If anybody in your immediate family, meaning a first order relative, your parent, your sibling, or your child, which is kind of odd, but in your immediate family, that's first order relative, had a sudden death or a heart attack or any other heart issues before the age of 55 in the male or before the age of 65 in the female, it's a plus for family history. Okay, got that. So what about smoking? So smoking, it would be a positive risk factor if they're smokers and they have not quit in less than 6 months. Even if they smoke one cigarette a week, doesn't matter the number, one, or they're exposed to secondhand smoke. Maybe they work at a bar or they have relatives that smoke at home. They need to be offered for 6 months before we can say that's not a risk factor. So that would be a plus here. Physical inactivity, being sedentary. So they're not meeting the minimum threshold, 500 to 1,000 meds per minute or 75 to 115 minutes per week. So if they do 75, which is a low threshold, you know, we can say that moderate to vigorous, we can say that they're not sedentary. Okay. Body mass index, we have two different ways of measurements here or screens. Body mass index 30 or greater, that's obesity, class 1, so we would say it's positive, or waist circumference, 40 inches for males, greater than 40 for males, greater than 35 for females. Consider obesity. If that's present, then they have obesity. Blood pressure, this has changed, so note that. 130, higher than 130 or higher, it's going to be positive. Either or of these. 80, diastolic, higher, 80 or higher. So 130 or 80 or higher, average of 2 readings in 2 occasions. Okay, so if this is happening, then there's going to be a positive risk factor. And so the goal is to get that down. Lipids, or what we're looking for, the LDL greater than 130 or HDL less than 40, right? So those are going to be, we want the HDL to be high and we want the LDL to be low. Okay, so those would be the main ones we're looking for. And blood glucose, So what we're looking for blood glucose, and depending on the test, is that your insulin and glucagon work together to keep it in that happy window of 70 to 110. When that's not happening, when you are fasted or where your blood sugar is spiking and it's not maintaining that happy homeostasis where it should be, then your blood glucose, you may have blood glucose pre-diabetes or diabetes. The most popular test now is the HbA1c, and if it's greater than 5.5, then that's going to be signs of pre-diabetes. Okay, so again, if the ACL though is greater than 60, it cancels out any of the others. So what do we do with this? So think that you have a new client. Let's say they have obesity. They have not been exercising. So then you begin an exercise program with them for 3 months. Okay. So if they have obesity and they're sedentary, just by losing a little bit of weight, maybe that they improve their body composition, their mass index, right? They're now physically active. You took away 2 risk factors right there. More than likely, their blood pressure, if it was high, it's going to go down because that's modifiable. Exercise will help to attenuate or reduce blood pressure as much as 10 milligrams of mercury. So that could happen. And cholesterol levels may also improve. So just by beginning an exercise program, you could affect all of the modifiable risk factors. Right? If they're smoking, they should stop. So it's all the counseling that we will do for better health. Right? So again, just remember, risk factors are not used for medical clearance. Major signs and symptoms are. The yellow box, yes, not this. This is for lifestyle counseling. Okay. So questions that we want to ask when we do our screening, if they're active for sure, right? And how active are they? How much are they doing and for how long? If they have any CMR, if any signs and symptoms of cardiovascular disease, so we got to ask questions, you know, you have any pain? Are you having shortness of breath? Any irregular heart rhythms? All those questions need to come from the health screen. And then the last thing is to, after we determine if they need medical clearance, is to assess the risk factors and then use those for programming to improve their overall health and counseling some behavior change. Okay, so let's take a look case study here. Okay, it takes some time here to take a look at it. Maybe stop the video and come back to it. Try to solve it. Okay. And all right, so hopefully you got the right answers. Welcome back. Okay. So he reports having calf pain. That's a big one. That should be a red alert. Okay. Maybe it's due to the fact that he's exercising a lot. 4 to 7 days, you know, maybe a little bit too much for him since he's taken over the kind of, but we're not physicians, so he would need further assessment. That could be intermittent claudication, which could be a sign of peripheral artery disease. So our best course of action is to say that he is having major signs and symptoms. So is he currently active? He is. Does he have a CMR? No, not based on the data we got from him, but he does seem to have calf pain. So we want to refer for medical clearance because of that. So yes, medical clearance is needed before any further activity with this client. Low risk, 1 risk factor present, and then at that age, he's older. Okay. All right. Then let's look at number 2. All right. Again, same thing. Take some time to read this. Stop the video. See if you can come up with the answers. You will have things like this in your exam. So stop. Okay, and you're back. Okay. So she's a female, 86. So let's take a look at some of the questions here. So is she currently active? She is. She teaches group exercise. Does she have a CMR? Yes, she has diabetes. She has type 1 diabetes. So yes, that's a CMR. Is she having any signs and symptoms? No, nothing reported. So medical clearance for her, because she's active, she can continue with light to moderate. If she wanted to do vigorous activity, we would need to send for medical clearance. Right? As far as the risk for cardiovascular is low because she has no risk factors, because as long as somebody with diabetes is well controlled, even if through medications, the risk is reduced. Okay, which is low risk. All right. Well, that's all I had for today. Hopefully, if you have any questions, always feel free to message me, and we can set up a time for office hours. See you guys next time. Bye.